We at the Asian Health Foundation want to share with you a few stories about a silent yet deadly disease that can affect you and your family. Now, if I can ask you to imagine the disease so widespread that has infected 1 out of 3 person in the world, so silent that it uses our bodies and our organs to multiply, quietly spreading to our loved ones and others within our communities, and slowly damaging our bodies. A disease that is so prevalent but yet little discussed and still almost infect a population as large as the United States. A disease that can kill nearly the entire population of San Francisco or Seattle every year. That disease is hepatitis B. It can live with some of us entire life and cause chronic hepatitis B. Now imagine knowing that you are carrying this virus, knowing that it can shorten your life by an average of 14 years, knowing that there's a 1 in 4 chance that you can die from it. Imagine the burden of the person that carry this knowledge, knowing that it may spread and not knowing when it may strike, taking his or her life away from his or her family. Now, he or her always would wonder if I would be there to share my life with my wife or husband. Would I be there to see my grandkids and my kids grow up? He or she will always wonder if I will survive this disease. Now, imagine that person is you or someone close to you who may be infected. Will you be there? We would like to share with you 3 stories of such a person. We appreciate the bravery, the candor of these patients to help to increase awareness of chronic hepatitis B. As deadly as chronic hepatitis B can be over the years, inflicting end-stage liver disease and causing cancer, there's still many things that you can do to prevent it and its complication. There are treatment and care that you can get despite the lack of cure currently. Indeed, there's such a vaccine, one of the only 2 in the world that can prevent cancer, and that is liver cancer from chronic hepatitis B. Liver disease experts, Dr. Minding Nguyen, professor from Stanford University, and Dr. Joseph Lim, professor from Yale University, will help to elaborate on the chronic hepatitis B and its treatment and complications. They will show you how to find out if you or your loved one carry it, how to prevent its spread, how to find out what stage the disease you may have, and how to get treatment. But above all, how to keep it from killing you or your loved ones.
Thank you very much, Dr. Dole, for your kind introduction. We hope in the next several minutes to share with you what we need to know about hepatitis B and why it is important to know. So first, hepatitis B is a viral infection, like the flu or measles. It's a virus infecting the liver. And where can we find hepatitis B? Hepatitis B can be found anywhere in the world. And you could see here most of East Asia and most of Africa, black or dark brown. So very, very common diseases in these areas. You can see that Southern Europe, Eastern Europe, and parts of South America also have a lot of hepatitis B. In the US, we are a low prevalence country, it's a light brown color here. However, we are a multi-ethnic society and country. So we have immigrants from many areas, including East Asia, Africa. And so in certain communities in the US, hepatitis B are also very, very common.
The way I found out was completely by happenstance. I was 18 or 19 years old, and I had a summer internship at a pharmaceutical company back in New Jersey. And while I was there for the internship, they had a blood drive. And I thought I'd be helpful. I donated blood, and about a month later, I remember getting a pretty thick envelope in the mail saying that I had, the blood hadn't been accepted because I had been tested positive for hepatitis B, and they suggested that I should get independently tested just to confirm. So that's what my family and I did. They took me to our doctor, and we ran some tests, and they confirmed that I had hepatitis B. I had no symptoms before that. Had I not, attempted to donate blood, I don't think I would have found out for many years.
We came as refugees, and I was, I guess a young child when we first came. And so I wasn't aware of it until I actually got tested for it when I was pregnant. But prior to that, I was just, a young, teenager leading on into, my early 20s, and wasn't aware that, I had hepatitis B.
About 15 years ago, I underwent a life insurance, physical exam and lab. So they went to my office, they checked before they gave me life insurance, and they saw, I have a hepatitis B antigen. I didn't feel sick or anything like that. I was healthy, no symptoms whatsoever, and the liver function test is always normal. And so when they informed me that I was a B carrier, I start to think, maybe there were some time during my past, I sometimes felt tired, but that's all.
I really wasn't aware of hepatitis B. I didn't think I was at risk. Even today, when I look back to my childhood, I can't think of a moment or an event that I can kind of pinpoint and say, that might have been where, the disease was transmitted. So it's a complete mystery to me.
I was surprised, and I started to talk with my family members. My mother at that time, probably she does not know things. Back in Vietnam, maybe she was a carrier at the most, but all my brothers and sisters, none of them had this. I informed them, have them tested, and I guess they had some clearance. But looking back, the only thing I can think of is maybe I got it from my mom. Maybe I was the one who did not, the immune system didn't clear that when I grew up. So that's how he became a carrier.
Now, how is hepatitis B spread? This is an important to know and to remember, because each of us, can help prevent hepatitis B by avoiding things that can spread hepatitis B, like sharing toothbrush or razor with someone who has known infection or at high risk for it. Routine dental or medical procedures, sharing needles. These are activities that can spread hepatitis B if one person is infected. Sexual contact. But the most common cause of hepatitis B transmission worldwide is actually from an infected mother to baby. But we do have very, very good effective treatment, vaccination of the baby at birth and giving the baby the hepatitis B immune globulin. That would eliminate the transmission well over 90-95% in most cases. It is also very important to know how hepatitis B is not spread. So there is no need to discriminate or isolate families or friends or people in our community, because activities such as hand holding, coughing and sneezing, sharing foods or food utensils, those do not spread hepatitis B. Breastfeeding, kissing, casual contacts, none of these can spread hepatitis B.
The only kind of overt symptom that I have is a mild ache on the right side of my body that shows up every 2 or 3 months. It hasn't really affected my energy level. I can exercise. I can play sports. I can go about my daily routine pretty easily without any hindrances or obstructions.
The most important thing to remember is that well over 95% of new hepatitis B infection has no symptoms, and the vast majority of chronic hepatitis B infections also have no symptoms until the very end. So that's why it is very important to try to diagnose it early. These are symptoms of severe liver diseases: yellow eyes, nausea, vomiting, fever, fatigue, abdominal pain, dark urine. So all of these are signs of very severe acute hepatitis B or end-stage chronic hepatitis B.
I'm always concerned because I've learned more about the disease. I know that it can get pretty serious, especially as I get older. It may become something that I have to deal with more actively. So I know the risks both of things like cirrhosis and of course liver cancer, which is the main kind of concern for me, and I want to kind of stay on top of that. So those are things that worry me, that are on my mind. Yeah.
And it wasn't until, I guess, probably over 20 years later, after I had my children, that I start feeling, more of the symptoms like fatigue. I went for actually a gastro for my stomach, because I wasn't feeling so good there, and I guess during that process we found out that my hepatitis B was more advanced, more chronic with my viral loads and my enzymes, and so that brought me to be more educated about hepatitis B. I didn't even know that. That it could lead to cirrhosis and even liver cancer, and possibly death.
This shows you the sequence of events. Chronic hepatitis B can cause cirrhosis, which causes liver cancer, or it can directly cause liver cancer without cirrhosis development before that. And what is cirrhosis? Cirrhosis is severe complete scarring of the liver. So, for example, if we get burned in the same place again and again and again, then we will just get thicker and thicker scars each time. So, it's similarly for chronic hepatitis B infection. So, over decades or years or 20, 30, 40 years, the liver can get very scarred, very hard, like rocks basically. It's a important liver cancer to do routine surveillance because it doesn't cause any symptoms until basically very, very advanced stage. It's not like a skin cancer we can see, or a lung cancer that usually patient would have a cough fairly early on. Liver cancer, no symptoms until probably the last few weeks or few months of life.
I would say go get tested. It's so easy. It's just a blood test. And the information that you find from it is so useful. And also it can, help you and help others as well. Just being aware of hepatitis B, what the diagnosis would mean and how to get treatment.
I'm a rheumatologist. I don't focus a lot on GI or liver issue, but it's my problem too. So I start to ask more questions about that, especially the Asian population. I think that the Asian population, everyone needs to be screened for that, especially the ones of my old generation. There are a lot of Vietnamese people who just came here within the last few years. I mean, because of some program, they came here. Even young people who came here only last few years in college level. I think all of them, if necessary, all of them need to be notified that they need to be checked for hepatitis B.
Get screened, get tested for hepatitis B. That is probably the most important first step, because without knowing that we have hepatitis B, there's no chance for proper evaluation for treatment. Very simple, inexpensive, and very accurate blood test can test us whether we have hepatitis B or not, and it could also test for evidence of immunity to hepatitis B. And why do we need to do that? It's because if someone is not yet immune or protected for hepatitis B, we have very, very effective and safe hepatitis B vaccine. Either 3 shots over 6 months or 2 shots over 1 month. And both are very effective and can produce protective immunity in more than 95% of vaccinated individuals.
Try to see a doctor as soon as possible. Don't delay. Especially if they're asymptomatic like I was, you can kind of sit on the disease and not do anything for years at a time. And that's probably not a good idea. There's nothing to be really afraid of, but it will be there for kind of the long term. So they have to be vigilant about it, and they have to be kind of persistent with with seeking help.
And at this point, I would like to turn this to my colleague.
Thank you, Dr. Wen. It's very important that if you are identified by your clinician as having hepatitis B, you need to just have a discussion as to whether you may require antiviral therapy or long-term monitoring of your infection. It turns out that only approximately 50% of all patients require antiviral treatment based on the activity of your infection. This is usually based on several variables, including how high is your hepatitis B virus level, how much inflammation is in your liver, what is the stage of your liver disease. There are other several factors that you and your clinician will discuss that may help determine whether you in fact require treatment or not. We're very fortunate that at this time we have 3 effective antiviral drugs, including PEG interferon, entecavir, and tenofovir. The first is injection-based treatment, usually administered once weekly. Entecavir and tenofovir are oral medications that are taken 1 pill once daily and with good tolerability.
The copy is like over 100,000, and symptom-wise, we got a little bit tired, and the liver function tests were high. So at that time, we started the workup, and then we started medication which is entecavir. Right? I think we started 1 milligram per day for a good several months. No side effect, did very well, and within a few months, I think the viral load went down to normal, to negative or undetectable, and all the liver function tests were also normalized very shortly after that, and that was more than 10 years ago, I think.
Now, it is important to note that unfortunately hepatitis B treatment at this time is not viewed as a cure. However, these medications are very effective in suppressing the virus to either low or undetectable levels, which in turn can have significant benefit for you as a patient. Now, the specific goals or endpoints of antiviral treatment include the following. First is to decrease the virus levels. Second is to try to decrease the inflammation and improve function of the liver. Third, it is our hope that a subset of patients may actually suppress their antigen levels, their E antigen and their S antigen, to low levels that may benefit the patient. And ultimately, we hope that these effects on the liver and on the virus itself may improve your liver function. Over many years of study, we now have confirmed that long-term antiviral treatment for hepatitis B is associated with a significant improvement with regards to the risk for cirrhosis, liver failure, and liver cancer, and can improve survival long-term. And so if you are identified as a patient that requires antiviral therapy, there are currently available options are very effective in achieving these goals. Now, if your physician has determined that you do not require treatment, it is important that you continue to follow up on a regular basis. Typically, this requires monitoring in the office twice per year or approximately once every 6 months. Depending on your characteristics, this may require a variety of different tests, which include liver enzymes, hepatitis B virus levels, monitoring for liver cancer with AFP blood test, and an ultrasound. And in some cases, your physician may determine that some form of fibrosis testing may be beneficial. Now, the determination of who requires liver cancer screening is nuanced, and this is something that you should discuss with your physician. However, there are a number of patients who are deemed to be at higher risk for liver cancer for whom regular screening twice a year is recommended. This includes individuals who have a family history of liver cancer, those who have cirrhosis of the liver, those who have another infection that's shared with hepatitis B called hepatitis delta, those who have certain risk factors based on country of origin, including those who are either African or North American blacks who are age 20 or older, as well as Asian males or females, depending on the age, typically at age 40 or age 50. These are general guidance statements, and therefore it is important that you speak with your clinician to determine what is right for you. Now, if you have hepatitis B, it's important that you build a good relationship with your clinician. And it is our hope that you'll be able to help determine what is the right approach overall for your management, recognizing that the natural history and the outcome of hepatitis B varies quite a bit between patients.
I was told seriously a few years ago that, what hepatitis B can do to you. And so that's when I asked my husband to get tested as well. And so we're both on the same treatment now. I wasn't expecting that, that it would turn out to be both of us. Once I start reading about hepatitis B and how it's transmitted, it wasn't, unexpected, So, yeah, that he would have it as well.
When we look at all the modes of transmission from one person to the other person, I was worried about that, so I have all the family tested for that. And because of that, I advised my kids and my family members to make sure they got the full dose of hepatitis B vaccination, and if it is past certain time, they need to have a booster, and they need to have every now and then check to antibody level, make sure it's okay.
I haven't needed treatment, and my symptoms have been fairly mild, mostly non-existent. It has affected me personally in the sense that I've had to obviously share the news with my family when they found out back when I was 18 and 19. They all got tested at the time to see if they had the disease or the virus, and they all tested negative. In terms of dating, it has affected me a little bit in the sense that, I try to inform my partner, whoever I would be dating, fairly early on in the relationship that I have this disease, and the conversation's always a little awkward. But again, luckily for me, everyone that I've been involved in has been very understanding.
And you can play a very important role in preventing spread of this infection to others. One of the things that I like to discuss with my patients is that if you are given a diagnosis of hepatitis B, that you should speak with your own family about whether they are potentially infected as well. Because hepatitis B, as noted by Dr. Nguyen, is often within families, you can play a role to ensure that your family, number one, is screened for hepatitis B, but number two, to do your part to minimize spread to others. And this is using common sense regarding the risk factors that we outlined earlier, including trying to avoid sharing of razors or toothbrushes because of blood, and then a caution with regards to sexual transmission as well. Among partners with hepatitis B, it is encouraged that if not already infected, that completion of a vaccination series may provide reassurance that the other individual is protected against hepatitis B infection.
I was worried. I thought about liver cancer and things like that. So I talked with my kids and my wife, and I said maybe we need to plan differently. So I cut down my work hours a little bit. I drink a little bit less wine, and then I'm fortunate that I was started on the medication and responded very well.
Certain things that you do can also lead to making it worse. Dessert is one of my my favorite, and as well as fatty foods, and that would be like fried foods and such. So I love all those, and I wasn't aware that those were really bad for you, especially when you have hepatitis B. And in fact, for me, it was even worse because then I found out that I had fatty liver. And so now I'm more aware of it. And so I'm, going to be, eating healthier, as well as, drinking more water, drinking lots of water, actually helps to flush out some of those toxins that are in your liver as well.
I'd like to highlight that there are additional steps for overall lifestyle that can really make a big difference in terms of your liver health. First, you should avoid alcohol consumption. There's likely no safe limit to alcohol consumption, but the general guidance is that you should try to minimize your intake of any form of alcohol, whether it's beer, wine, or liquor. In fact, I usually recommend to my patients a complete limit of 0 because we know for sure that is safe. We know that some patients are more vulnerable to even modest consumption levels. Number two, there are a number of medications that are known to be liver toxic. And so I would encourage you to speak with your physician as to whether the medications you are taking are considered to be safe or less safe in the presence of hepatitis B and liver disease. We use the example of acetaminophen or Tylenol because we know that beyond certain levels, typically more than 2 grams per day, that there is potential harm. And so that's an example. If you have taken 500 milligram tablet of Tylenol, up to 4 a day is completely safe. And some others may have slightly higher cutoffs as well that may be deemed to be safe and should be discussed with your physician. And then finally, I'd like to highlight that all is very, very common that patients like to use supplements or herbal remedies in the context of liver disease, that we know that some ingredients may be potentially liver toxic. And as such, we encourage you to, again, bring this up during your office visit and have that conversation as to the ones that you might be interested in pursuing, whether they're a good idea or not, with full consideration of your overall health profile and the status of your liver disease. And I also do want to mention that one of the entities that is becoming increasingly common is what we call fatty liver. This is largely due to overweight, obesity, diabetes, and the like. And because of this, this extra fat in the liver can cause greater stress and injury or inflammation to the liver. And therefore, your clinician may advise additional steps to decrease weight to minimize the additional stress on the liver.
If I have to say what we should remember or walk away from this 1, 2, and 3, I think number 1 is to get tested. If you come from anywhere in the world or know that you have contacts, close household contacts or sexual contacts with someone who may be at risk for hepatitis, then you should get tested, a very simple blood test. As Dr. Lim also mentioned earlier, the family and those close to you should also be tested for both infection and for opportunities to get vaccinated. That is probably the most important step, because without that step, there would be no chance for monitoring or for treatment. We do have a very useful and effective treatment. But if we don't get tested, if we don't get diagnosed, then there is no chance for any steps afterwards.
Absolutely. I think it's really important to note that the decision to pursue antiviral therapy is an individualized one. And so please do have that conversation with your physician as to whether it's right for you. There are important differences between the available treatments, and that's something that you should have full discussion as to the pros and cons of each approach. We are very hopeful that in the future, we may have even better medications that can achieve not only suppression of the virus, but potentially permanent or functional cure of hepatitis B. But at this point in time, I think the key decision point is whether you need treatment or not. Remember, only about half of patients need treatment to begin with, but among the patients who do not, ongoing monitoring, regular testing with blood work, regular screening for liver cancer is vitally important. And a subset of these individuals who do not require treatment right now may require treatment in the future. And so I think the key message here is that if you are diagnosed with hepatitis B, you would like to build a really close relationship with your clinician so that you can make a good decision as to what is needed to keep your liver healthy. You want to be there for you and your family in the same way that your clinicians will want to be there for you. So with this, we thank you so much for your participation in today's program, and we look forward to partnering with you and your clinicians, improving the management of hepatitis B infection.
So with time, I feel more confident. And with the reading that I've been keeping up with, I think that at least I have a good chance to live almost close to normal. Although there's still some risk of liver cancer still there. It's not going to be zero. But at least, it's not too bad. It's not like a death.
Well, thank you for viewing the video, and you have seen the 3 very powerful stories of people who have been infected with hepatitis B, how they found out about the disease, each with different story, some not knowing that they have had it, and some have probably, unfortunately, have gone through many years without follow-up, but finally many have been able to get the care and the treatment so that it can help to prevent future complication of chronic hepatitis B. I hope that you see this video, that you can see yourself and other people in your family in these kind of scenario, so that you can use the education that provided by our expert, Dr. Min Nguyen and Dr. Joseph Lin, so that you can be educated, be aware, and be there for your family, and ultimately to stay healthy. Thank you very much.